there. My name is Dr. Mad. I'm going to do your cranial nerve exam. Very nice to meet you. Let's go ahead and verify your first and last name and your date of birth. Okay. Perfect. Do you have any allergies? Have you had any fevers in the last 24 hours? Perfect. Any respiratory problems? Shortness of breath? Any palpitations? Are you experiencing any symptoms of anxiety or insomnia? Okay. Any history of seizures? Are you taking any medications? How many milligrams? Okay. So what we're going to do today is a full cranial nerve exam. We're going to test all 12 cranial nerves. Okay. And are you experiencing any other symptoms? Okay. So let's go ahead and begin. Are you having any pain right now? Okay. And have you noticed any changes in taste? You do feel kind of a metallic taste? Okay. And when did that start? I see. Okay. And any changes in your smell? No. Wonderful. Are you experiencing any tingling sensation around your mouth? Okay. I'm gonna go ahead and take your oxygenation just to make sure that everything is okay. I'm going to put this on your index finger. Great. Go ahead and relax. Take a deep breath in for me, please. Good. Okay, your oxygenation is 99 percentile on room air. I'm not worried about that. I know you said that you're not having any fevers, but I do want to check you if that's okay. So I'm going to go ahead and put this on your forehead. Okay, 99.1, a little bit elevated, but I'm not concerned. Have you ever had hypertension? Okay. Well, hypertension is elevated blood pressure on multiple occasions. Alright. I'm going to put this on your arm. Can you lift up the sleeve? Good. Alright. Do you mind holding this for me? Thank you. Okay, go ahead and relax. Can you please uncross your legs? Thank you. Okay. All right. Your blood pressure is a little bit elevated, but let's go ahead and continue to check. I really don't want to jump to any conclusions, so don't be alarmed yet. Vital signs within normal limits. I'm going to go ahead and start by examining your eyes. Okay, can you please look straight in my nose? I'm going to flash a light in your eyes. Good. And on the other side. Keep on looking at my nose. Okay. Good. Now can you please look up? Okay. Same thing. Look up. Okay. I'm gonna go ahead and check the pupil size. It's about between 2 and 3, which is normal. Alright, I'm gonna go ahead and bring my pen very close to your nose. So go ahead and focus on the pen. And I'm going to bring it very close, very close, very close to your nose. Okay. Alright, I'm going to give this to you, and I need you to cover one eye. We're going to check your vision with the Snellen chart. There you go. Okay. So go ahead and cover the right eye now. And can you please tell me what color this is? Okay. And what color do you see here? Good. Can you please tell me what letter this is? Great. And what letter is this? Good. What about this one? Good. And what about T? Can you please read the last row starting with the first letter? Perfect. Now let's go ahead and switch eyes. So cover your left eye. Can you please tell me what color this is? Good. And what color is this? Perfect. Can you please tell me what letter this is? What about this one? S. And what about this one? H. Can you please read the last row starting with the last letter? H, B, F, D, L. Perfect. Okay, let's go ahead and check your peripheral vision. I'm going to ask you to cover one eye, and I'll do the same thing. And please tell me when you see my fingers in your field of vision. Now, good. Now, good. Now, good. Okay, let's go ahead and switch eyes. Now, good. Now, good. Now, perfect. Okay, so keep that eye covered for me. And can you please tell me how many fingers do you see? Good. What about now? Perfect. And what about now? Excellent. Let's go ahead and switch eyes. Tell me how many fingers you see. Good. What about now? Excellent. And what about now? Wonderful. So no double vision there. Alright, I'm gonna go ahead and just palpate around your eyes to see if you're complaining of any pain. Okay, I'm gonna go ahead and tap. And look at the light. Good. Follow the light with your eyes only. Don't move your head. I'm looking at the light. Good. Okay, perfect. I'm gonna go ahead and check your neurological responses. What I'm going to do with the hammer is I'm going to slowly tap on your chin. Let me know if you feel any kind of pain. Okay, go ahead and relax your jaw for me, please. Good. And now I'm going to move down the body. Good. And your elbow. Good. Okay. And on the other side. Good. Good. Okay. I'm not seeing any abnormalities. Can you please squeeze my fingers? Really, really strong. Okay. And now put your arms like this for me. Okay. Good. I'm gonna try to open them up. Don't let me do that. Okay. So no problems there. I'm going to check your facial sensation. What I'm going to do is I'm going to touch you with this cotton ball, and go ahead and close your eyes. I'm going to show you how it feels like. I'm going to touch you right here on your chest. Okay, so that's what dull will feel like, and then I'll show you what sharp is, and that's what sharp will feel like. Okay, so go ahead and keep your eyes closed and tell me if this is sharp or dull. Dull. What about now? Sharp. Okay. What about now? Dull. And now? Dull. Okay. Now go ahead and close your eyes and tell me where you feel this. Left cheek. Nose, forehead. Great. I'm gonna go ahead and check the ocular pressure. Now, I'll also be checking your optic nerve. So go ahead and look behind me, straight at the wall, please. Good. All right. Keep on looking. Try to keep your eyes open. Okay, let's go ahead and check your other eye now. Optic nerve is intact. Okay, I'm not seeing anything abnormal in this eye. No signs of inflammation. Okay. Are you experiencing any pain inside the nose? No? Okay. Now I'm gonna go ahead and just palpate your nose. Let me know if you feel any kind of pain. Okay, wonderful. I'm going to go ahead and close one nostril. Can you please breathe in, breathe out? Good. And I'll do the same thing on the other side. Breathe in, breathe out. Okay. Let's go ahead and check your smell. Go ahead and take a deep breath in and let me know if you can distinguish the smell. Okay. It definitely smells like energy. Okay. Yes, it is refresh energy. Perfect. Now this one is a classic. I'm gonna have you take a deep breath in and breathe out. Good. Definitely smells like lavender. It's also very calming. Okay. Go ahead and take a deep breath in and exhale. Great. Yes, it's definitely stress away. Right, what I'm going to do is I'm going to take a swab of your nose. We're going to take a few cells and just test them underneath the microscope, under the microscope, and we'll be able to tell if you do have any neurological disorders. Okay, so go ahead and look up. Good. And one more. Okay. I'm gonna label this and send it to the lab. I also want to take a look inside your nose if that's okay. So go ahead and look up for me. And on the other side. Okay. I'm not seeing anything. Your mucosa is pink and moist, and I could not see any lumps either. Good. Now I do want to check your ears. Just gonna go ahead and change this. Make sure that I'm not taking any boogers and put them in your ear. Okay. So first what I'm going to do is to visualize the ear on the outside. Okay. I'm not seeing any lumps. Skin is normal color. Right, and on the other side. Okay. Both ears are symmetric. I'm going to pull down, back, and up on your ears. Let me know if you feel any kind of pain. Okay. And are you experiencing any pain while I'm palpating right here in the back? Okay. So that's the mastoid bone. I would be very concerned if you would have some pain or tenderness there, but you're not, so that's safe. Okay, let's go ahead and check inside the ear. Make sure that you have no obstruction, no cerebrospinal fluid, and that the tympanic membrane is intact and normal color. Can you please look that way for me? Tympanic membrane is pearl gray. Margins are well defined. And I'm not seeing any abnormalities. Okay, let's go ahead and check your other ear. Nothing to be concerned there. Great. So you shouldn't be having any hearing problems. Okay. I'm gonna go ahead and check your hearing. I'm a little bit concerned that you are actually experiencing what we call under the water phenomenon. Okay, but maybe I'm wrong. So go ahead and close your eyes. Can you please tell me with which ear you hear this sound? Good. Good. What about now? Okay. I'm going to whisper a few words in your ears. I'm going to need you to repeat them back to me. Great. 1979. Good. Rainbow. Okay, great. Medical assistant. Good. Stethoscope. Okay. Thermometer. Good. Blood pressure. Okay. Wonderful. Everything sounds normal. You are able to repeat all the words back. So I don't think you have the underwater symptom. Okay, but lastly, I'm going to check your hearing with a tuning fork. Can you please tell me when you don't hear the sound anymore? Okay, and same thing on the other side. Now, wonderful. Okay, next I'm going to ask you which position here is louder. Now, some people say position number 1, some people say position number 2. So don't be alarmed, there's no right or wrong answer. Okay, this is position number 1. And this is number 2. Which one felt louder? Number 1. Okay, well that's very strange. Let's go ahead and try that again. So this is position number 1. And this is position number 2. Oh, number 2 now. Okay, good to know. Alright, this is position number 1. And this is number 2. Also number 2. Okay, so both ears are equal. Alright, now you were complaining of some changes in your taste. I'm really sorry to hear that. Yeah, it's very, it's very bad when you can't taste the food. Yeah, it's horrible. So, no worries. I'm going to be very gentle. Now what I'm going to do is I'm going to check inside of your mouth. So I'm going to just gently press down on your tongue. Can you please give me a big ah? Good. Okay. Close. Now open again. Say ah. Okay. Alright, so I know what the problem is. Yeah, your throat is a little bit enlarged. Now, I don't want to alarm you. Something like this could happen after a viral infection. No worries. It'll go away in about a week. Yeah, changes in your taste is very normal after a viral infection, and your taste should resume in about 2 weeks. Okay. But let's go ahead and see how bad your taste really is, and if you can distinguish any of the samples that I have in my office. Alright, so what I'm going to do is I'm going to place 1 drop on your tongue. Go ahead and give me a big ah. No, I'm so sorry. That is definitely not watermelon. Okay. Let's see. Go ahead and open your mouth again. just one sample. Oh no. So everything tastes like onion? For you. This was strawberry. Okay. I'm just gonna go ahead and try one more. Onion again. Okay. I told you what the problem is. Definitely you're recovering from a viral infection. Nothing to be worried of. I'm just going to go ahead and prescribe some medications for you. And most of the medications will be for immunity boosting. Now, I do need you to sleep about 8 to 10 hours per night. Can you do that? Okay, so I'm going to write down 8 to 10 hours. Magnesium sometimes helps before you go to sleep to relax and to relax your nervous system as well. Well, the good part is that I could not see any abnormalities with your cranial nerves. Everything was normal. And I believe you can go back to school on Monday. Alright, you have my signature here. You can take the prescription to the pharmacy down the street. Do you have any questions for me? No? Alright. Well, thank you so much for coming in. If you have any other symptoms or, worsening symptoms, don't hesitate to call me. Thank you. Have a good night.